The beauty of LASIK today is it's so much safer than it was when I started doing LASIK back in the early 90s. That said, I had LASIK myself back in 1993. Okay, those were the days when the laser was almost as big as this room, and we didn't even have an eye tracker. So I guess I've seen kind of the beginning of this industry, and I know where we are today. What is amazing to me is that LASIK today, with modern technology, is actually almost 10 times safer than wearing contact lenses. People don't think at all about putting a contact lens in their eye, but they don't realize that there's people that have a corneal ulcer, they can go blind from wearing contact lenses. Admittedly, it's very rare. Well, the risk of those same type of things happening with LASIK is literally 10 times less than with contact lenses. So the risk of a serious problem with LASIK is about as close to zero as you can calculate. But what do we see in everyday life? Well, the typical thing that we've been worried about over the years was glare and halos at night. Okay, that was a big problem a decade ago. With modern technology, with wavefront aberrometry, eye design, large optical zones, lasers that produce just incredibly smooth and very accurate corrections on the eye, I just basically don't see halos at night. In fact, what we hear from patients is their night vision is better, superior than it was with their glasses or contact lenses. So even at a very bad outcome, it would be about their night vision would be about the same as it is with their glasses. Well, it's hard to call that a complication or a risk, but that's basically what we see. So it's the biggest problem we've seen historically gone. Okay. The second problem we used to deal with a lot was dry eye after LASIK. And that was very problematic in the days when we used a blade or a microkeratome. And crazy as it may seem, there's still places using that today. But even back in 2002 with the first femtosecond laser, we saw a 50% reduction in dry eye, just like that. And that was phenomenal. Each generation of laser, less and less dry eye. Today, I virtually never see dry eye in men. Well, it just doesn't happen. In women, maybe over 45, we did a study on this, looking at the modern technology. Only 1% of women over 45 had any worsening or any increased symptoms of dry eye after modern LASIK than they had prior to LASIK. So we have pretty much tamped down dry eye after LASIK. Beyond that, there's really not much to worry about. The old problems with flaps and whatnot with a laser, it's been a year since I've seen those kind of complications. So yeah, it's the safest procedure probably that anyone can undergo, and it has to be. The people that are coming to us today, their expectations are up here, okay, and we have to deliver. Many patients have come back, they're seeing 20/20. It's a little blurry, doc. Fine, we're taking back, and we get them better than 20/20. That's the capability. That's the exciting part about doing what I do, is that I can make people better than they've ever been, and we can do that routinely with minimal risk. Again, less risk than what they were doing before with contact lenses and even glasses.